I want to welcome you to Access Living and our next town hall meeting. We have a rather diverse agenda today covering quite a few different topics, and hopefully you're interested in all of them, but hopefully also that there's one or two that are of particular interest to you. Did you get a program as you came in today? Most of you have programs? Okay, there's some other handouts that we'll be coming around with too. I know this is kind of a strange time in history, it seems to me. We had what happened in Brussels this morning. We have serious, a lot of people dying in places like Syria, Yemen, Libya. And, this is not a very stable time. We also have a very weird political climate, I think, with some candidates behaving like we've never seen before. I would say there is one bright spot. We actually have a candidate who endorses and supports single-payer health care completely. Yay, that's something that we hadn't seen in a while, and that's a really good thing. I also want to just point out a few things. We have bathrooms down the hall. They're on the left side, okay? We have a couple of PAs here today. I know Garland is downstairs helping getting the snacks ready, and I think Melinda is maybe just a little late getting here. Well, hopefully she shows up. And I also want to thank our interpreters that we have today to do sign language so that we are more accessible to the community. And I think that's it. We will get started with no further delay. And our first speaker is going to be Judy Panko-Reese, and she's going to do a piece first on women's health care, and then she'll continue talking about durable medical equipment.
Thanks, Tom. As Tom mentioned, my name is Judy Panko-Reese. For those of you who don't know me, I'm a healthcare policy analyst here at Access Living. We work with trying to make sure that people with disabilities get quality access and affordable access to good health care. And we do that for everybody. But one of the areas that I've worked on in particular has been reproductive health care for women of all ages throughout the lifespan. And I work very closely with Philani Thrasher here at Access Living, who is the Women and Girls Community Organizer. Many of you probably know this, but I'm just going to remind you, Tom's got a copy of the guide that we put out. It's called Take Charge, a Reproductive Health Guide for Women with Disabilities. It's written by and for women with disabilities, and if you're not familiar with it, you should definitely link up with myself or Philani Thrasher to learn more about it. It just gives some very easy tips on things that will make your visit with your healthcare provider as a woman with a disability a lot easier and a lot more user-friendly, irrespective of the kind of disability that you live with. I'll also remind that many of you who have, I want to thank those of you who have responded to the flyers asking for women with cerebral palsy, women with spina bifida, women living with the effects of stroke, to interview with the researchers over at RIC, Dr. Gabler's group. And if any of the women here today know women with those disabilities that want to get involved in this research project, that has a small stipend available for those of you qualified to participate. You could let me know or follow up with Tom, and I can give him the information. Now, finally, I wanted to mention durable medical equipment, which is wheelchairs, power wheelchairs, walkers, canes, and manual chairs as well. As you know, we at Access Living have been trying to expedite people getting repairs to their complex wheelchair equipment and to help expedite getting either replacement chairs, loaner chairs, or even new chairs when they're eligible for them, and possibly intervene with the seating and positioning appointments that need to be made. Scott's going to talk to you a little bit more about this later. But the two things I want to mention to you is that if you know anybody who uses equipment or needs equipment, you should be aware of two things. One is that Access Living puts together a DME, a durable medical equipment work group, every other month here at Access Living. You're welcome to participate on by the telephone. I usually can send out the telephone conference phone number, or you're welcome to come and join the work group in person. It's comprised of healthcare providers, policymakers, and consumers who are really trying to improve the access to quality, durable medical equipment to people with disabilities in Chicago. So we are very lucky today to have Lynette from the Illinois Assistive Technology, is it? And she can tell you a little bit more. I just want to impress on everybody, if you know anybody or you are a person who could benefit from assistive technology, and that could be in anywhere, any place, but for someone like me, I'm especially interested in helping you understand that you can use this in your doctor's appointments and in your doctor's visits. And we have many, many people that benefit from assistive technology, and Lynette's going to tell you all about her program and a little bit more.
Good afternoon. Can everybody hear me okay? I see several people in this room, besides using scooters, wheelchairs, canes, and hearing aids, that are using assistive technology. Does anybody know what the other assistive technology that's being used is? Nope, I'm using assistive technology. Nope. My glasses. If you guys ever see me on the road without my glasses, get off. I'm dangerous. I'm going to talk to you a little bit about the Illinois Assistive Technology Program. We are a non-for-profit located in Springfield, Illinois. We service all ages, all disabilities. And we promote the use of assistive technology devices and services to promote independence not only at home, at work, in the community, and in school. We have been in existence for 26 years now. I can tell you that I travel from one end of the state to the other. Next month, every week, I'm going to be in Chicago at least once. So I do travel quite a bit. I am our special projects coordinator. Not quite sure what that means, other than when my boss says go, I go. We were talking about DME. We get a lot of DME equipment that is donated to IATP that we do give out. But the first program I want to talk to you about, and back on the table there, I have a small sampling of different types of assistive technology, but we have an 8-room demo center in Springfield, Illinois. One of the things I do is I bring the assistive technology to other places so people can see it. Things for vision, for hearing, writing, communication devices. So it's a good way to see all the technology all in one place. Now, we have several vendors that have graciously lent us equipment. So we actually, in our demo center, have a bathroom with the roll-in shower and the overhead lift, so people can see how you can go from your bed to the shower or to the commode. Like I said, great way to see it. And we do cover all disabilities in that demo center. The other thing we do is we have a device loan program where people can borrow devices to try them for 5 weeks at a time, free. You need a communication device with an eye gaze system, $18,000 piece of equipment. You can borrow that from us for free. So it is a good way to compare different devices that are out there. It is a good way to get familiar with them. I can tell you that I go to Moline at least 3 times a year to talk to a group of special ed future special ed teachers, And I bring all kinds of equipment with me so that when they go into the school setting, they know what assistive technology is. We also have a program called iLoans. And with iLoans, we are the bank. So if people need assistive technology and cannot get it any other way, they might want to come through our program and borrow the money through us. We do look at credit scores. However, if there's a lot of medical on there, that goes away. So that's not included in your credit score. So we rerun the credit score, make it affordable. I can tell you that now we only do up to $5,000 for home modifications, because in the past we've had to purchase homes to try to get our money back. So we do simple things like widen doors, put in a roll-in shower. The interest rate is 3 to 5%. We loan up to $35,000. Good way to get it. With the iLoan program, we also have what is called a credit builder program, where you can borrow anywhere from $250 to $1,000, and it will help you reestablish your credit. The one program that I really love, and I wish my director would one day put me in charge of that program, is our AT Classifieds. I can tell you, we're talking about durable medical. Not only durable medical, but we also get communication devices, vision devices, hearing aids that we are able to refurbish and get out to somebody that cannot get the equipment. You were talking about wheelchairs, Judy. You get a wheelchair and you break it within that first couple of years, it's not going to be replaced. They require 5 years before they even consider replacing the wheelchair. So, and I can tell you that about 3 years ago, who knows what a standing wheelchair is? Okay, some of us do. A standing wheelchair will take you from the sitting position to standing up. If you know anything about those wheelchairs, they start off at about $20,000 and go up. We had a gentleman that got a standing wheelchair. He had 30 days to return it. At 32 days, he decided he didn't like it. He donated it to our program. A $20,000 wheelchair that was given to us that wasn't even 2 months old, and we were able to get it into the hands of a young lady that wanted a standing wheelchair, but her insurance would not cover it. We get a lot of hospital beds. We have on occasion got vehicles with that are already modified that were donated to this program. I can tell you when I leave here today, I'm going through Morton, Illinois to pick up equipment. So we pick up equipment from all over the state. A couple times a year, Jane will get a U-Haul and start off Wisconsin border and work her way down. So if you need the equipment or know somebody that does, you might want to check her with our AT Classifieds. We also provide training. So if you get a device from us, we will come out and do the training. A lot of our trainings are on the software, like Dragon Naturally Speaking, JAWS, Zoom Text, Read and Write Gold, Kurzweil. So if you get a computer and you have specialized software and you need training on it, call us. We'll come out and train you. We also do trainings on how do you pay for assistive technology, why assistive technology works and doesn't work. A lot of people think the first thing you see is going to work. It doesn't. I can tell you I deal a lot with communication devices, and it's usually the third or fourth device that a student tries that then the student will use. iPads. iPads are really big as assistive technology right now. They use them a lot for communication devices. But there are also apps on them for vision, for hearing, for literacy. So you might even want to check out one of our iPads and see the different types of software. One of the things we do for Department of Human Services is we do evaluation and trainings for their clients. So if you're a client of Oak Rehab or Home Services, you can be evaluated by our ATSs, which are Assistive Technology Specialists. And if you need equipment, we can provide the equipment for you. One of the things the state has done is they get federal money that they cannot spend at this point. So they are filtering it through our open-ended loans. We are buying the equipment for their people and getting it into their hands quickly. Right now, if you were transitioning from high school to college and you were voc rehab and you needed a computer with specialized software, you're not going to get it unless you come through our program. The state does not have the funds. The open-ended loans, they cover everything from vision to learning. They do software, computers, magnifiers, and I actually have on my back table over there 2 different types of video magnifiers that you guys can stop and see. We also get federal money from the State Board of Education. So far, our budget has been okay because all of our money is federal money. So far we're going strong. May change come July 1st. But the State Board of Education gives us the funding to provide assessments for K through 12. So we're able to go into the schools, and if anybody knows anything about an assessment, they start off at about $1,000 and go up. So we're going into the schools, doing the assessment, recommending equipment for students to be successful, and then they're able to borrow it through our device loan program. For 5 weeks, they try it, make sure the child is going to use it. If they're going to use it, then the school, through IDEA, is obligated to provide that. We also have somebody on staff that does individual educational planning services for parents. So they will help the parent understand the IEP process and work with them to help them get the equipment that their child needs. Another really, really good program that we offer is called the WIPA program. It's the Work Incentives Planning and Assistance Program, and it's for people that are on SSI or SSDI that want to go to work or are thinking about going to work. It's going to help them understand their benefits, how much money they can make before they start losing, how long they can keep their health insurance. We have 3 people throughout the state. One is here somewhere in Chicago, but I'm not quite sure. We just hired Brittany not too long ago. And this is through the Social Security Administration. So they are funding that program. Again, if you know somebody that wants to go to work or you want to go to work, give us a call. We'll put you in touch with the proper person. They will explain your benefits to you. I mean, you're looking at, food stamps and workers' comp and unemployment benefits. What can you make? What benefits are you going to lose? So they help you understand that entire program. And that's what we do. We are, like I said again, a non-for-profit, all ages, all disabilities. There are about 6 of us that travel continuously, all up and down the state. We'd love to be able to answer any questions that you guys might have about IATP and the services we offer and how we can be of help to you guys. What can we do to make your lives better? What kind of things are you seeing out there that are not being addressed?
So, Lynette, I have a few questions. The first is, you mentioned some of the software programs, which I assume because of the licensing, you guys can't lend anything like that, like Dragon or Zoom Text or anything like that. But do you have any kind of helpful hints about maybe which version or which program might be more effective for people with various either limitations, visual or physical? I mean, kind of resources do you offer when it comes to like those software things, like those kind of programs? That's the first question. And then the second is, can you work with people who don't have Apple cell phones but need ways to access the Android apps and that might be more disability friendly too?
Okay, you're correct. We cannot loan out the software because of licensing issues. However, we loan out laptops with the software already installed, and they are the latest versions. Dragon Naturally Speaking, for those of you who do not know what it is a voice recognition software. I can tell you when I started with IATP 13 years ago, it took me like 7.5 hours to train it to my voice. Today, I can sit down with Dragon 13 and in half an hour be able to run my whole computer. So we try to keep up with the latest versions because it's like any other software. As it gets better, the newer is better and easier to use. As far as Android apps, they're starting to come around. I can tell you right now, like for communication apps, Apple still has the best communication apps out there. It is coming around though, and there's several of us on staff that have been playing. I own an Android phone. I've not gone Apple yet. And somebody will come up to me and say, hey, I heard about this app, so I download it real quick, and several of us will play with it. And if we think it's a good app, we do have an Android tablet that we put these apps on so people can try them. Does that answer your questions, Judy?
I guess in addition to that, I mean, is there like an e-newsletter or, do you guys like send things out technically? Is there like an e-newsletter list that we can get on to kind of keep up with stuff?
It's funny.
I mean, you guys are technology, so I would assume you have an e-list.
It's funny you ask that because we used to send out a quarterly newsletter, and we quit. And just recently at a staff meeting, we said, we really need to bring this back because there's so many changes. And if you know anything about assistive technology, you blink your eyes and there's something new out there. I can tell you, like our communication devices, that if you know anything about communication devices, they used to be on like a computer-based system. They're all on tablets now. And that's only been within the last 1.5 years, 2 years. So they're doing away with computer-based and going more towards Androids and Apple iPads. But we did discuss bringing back a electronic newsletter.
I mean, that seemed to be an appropriate kind of form of communication for your organization. But I think it would also, I mean, if you had the e-newsletter and you had links in it to either your website or to some of the resources you offered, it would help us keep current. As you say, it's a playing field that's changing all the time. And for those of us that really have very disability-specific questions and needs, it would be really helpful to know that we would just have access to somebody that's kind of like monitoring this stuff for us.
You can go through our website. We also now have a Facebook page that when we see things come out, because of the way we're funded, we cannot recommend one thing over another. And that's where the device loan comes into play, as you can try the different devices. And I have to tell you, we sell nothing. We are information and referral. A lot of people think we sell things. We do not. We want to make the public aware of what is out there, how it works, why it doesn't work. One of the things I like to do is when I go out and do trainings is I talk about why technology doesn't work. And especially communication devices. If you get a 16, 17-year-old and you give them this great big device that looks different from what everybody else is carrying, are they going to use it? No, but you give them something like an iPad with that communication app on it, they're more likely to use it. And when you're looking at assistive technology, you have to take consideration, is it under warranty? Will it work in all different scenarios? So that's pretty much why we're here. is to let you guys know that type of information. Check out our Facebook page, though, and it's the Illinois Assistive Technology Program. And we are putting things as they come out, and we're seeing them. We do in no means endorse them, but so people can compare if they know of something different. Anybody else?
Any more questions? This is your chance.
I'm trying to help a person in my building too as well. I'm disabled, but I help them. They like in a way bedridden and stuff like that. And as far as all the chairs, she had one roller chairs, and then it's hard for her to get in and out of bed. And I would like to know, find the job situation too, because I am on SSI, and I need the number to that. So I just like to know, is there any kind of way I can get a number, something for she can call them and get that help for her?
Back at the back table, there are some of our brochures, and they look like this. And that has all our contact information on the front. And give us a call. And as far as your neighbor transferring, does she use a transfer board to get in and out of bed?
Yes, the one of them boards that slides in off. Yes.
There are a lot of different things out there, though. We may have something else that
she had failed so many times. Ambulance had to come. Sometimes she would call me, and she kind of heavy trying to put back up in the bed, or even get into a wheelchair. So she needs something that's going to be more motivating, for her.
Give us a call, and we can go into more depth with that and see what else we can find.
All right, thank you.
Yeah, I just want to add something too. It may be that she'd qualify for home care services, and transferring is a very important part of home care. So you might see if she qualifies for that.
Hi, my name is Kathy Powers, and I've more to my mouth? Okay. I've recently experienced significant hearing loss, and I'm told I need hearing aids on 2 ears, and I have no resources to get them. Can you help me?
I just spoke at the Sertoma Club in Decatur, Illinois, and was just made aware that they have a funding program for people that cannot get hearing aids. So I would check in to see if there's a Sertoma Club here in Chicago, and it's SERTOMA, and it's a civic group. But the gentleman in Decatur was telling me they take old hearing aids and refurbish them. So
Or get run over.
it's a good program. I was really impressed with what they do. It's Sertoma Club.
Thank you. Thank you very much.
The other civic club that does hearing is the Lions Club. Okay. So those are 2 options, and I know they both give away hearing aids.
Okay, thank you.
Any other questions? Well, I do hope you'll stop back and see some of my assistive technology I brought with me in the corner here. And if there's any other questions, I'd be happy to answer them at that time. Thank you.